If you or your child has been diagnosed with hydrocephalus or advised urgent brain surgery, you are likely overwhelmed. Can it be treated successfully, and which surgery is right for you? Should you choose a standard VP shunt or an endoscopic third ventriculostomy, and can you receive this advanced care in India at an affordable cost? In this guide, we will provide the answers. In the next few minutes, I will explain the different types of hydrocephalus, the diagnosis process, surgical options available in India, recovery timelines, and a detailed breakdown of total treatment costs. Hydrocephalus is often called water on the brain, but it is actually an accumulation of cerebrospinal fluid or CSF. This clear fluid normally cushions the brain and spine, playing a vital role in protecting your nervous system. Normally, roughly 500 milliliters are produced daily, but only 150 remain because the fluid is continuously reabsorbed. When this balance is disturbed, fluid accumulates, creating pressure that can affect surrounding brain tissue. Obstructive hydrocephalus occurs when a physical blockage like a tumor, cyst, or congenital narrowing prevents normal flow. For these cases, endoscopic third ventriculostomy or ETV is often the preferred surgical solution. The second major type is communicating hydrocephalus. Here, fluid moves through the ventricles, but normal absorption into the bloodstream is impaired. Many of these patients will require a VP shunt for effective long-term management. Hydrocephalus affects all ages from congenital conditions in infants to seniors with normal pressure hydrocephalus. NMPH often presents with difficulty walking, cognitive decline, and urinary urgency, requiring very careful specialist assessment. Diagnosis begins with a detailed neurological exam and imaging like MRI or CT scans. MRI is especially valuable as it allows a neurosurgical team to identify the site of obstruction and plan the safest possible surgical approach. A VP shunt is a widely used treatment where a thin catheter is placed into the brain's ventricle to redirect fluid to the abdomen. The catheter connects to a pressure regulating valve and the fluid is naturally reabsorbed. Modern shunts often use programmable valves, allowing us to adjust pressure settings externally without a second operation. However, shunts require long-term monitoring for complications like blockage, and some patients may eventually need revision surgery. Endoscopic third ventriculostomy or ETV is an advanced procedure that uses a small neuroendoscope to create an alternative fluid pathway. If successful, this helps patients avoid permanent dependence on a mechanical shunt system. ETV is not suitable for everyone. Success depends on the patient's age, the underlying cause of hydrocephalus, and the exact anatomy of the brain's ventricles. The choice between a shunt and ETV is always made on a case-specific basis. Hospital recovery typically lasts between 3 and 7 days. Mobilization is encouraged as soon as the patient is stable, and our team monitors for balance and neurological improvement within the first 48 hours after the procedure. International families should plan to stay in India for 10 to 14 days to ensure stability and a final checkup before flying home. This period allows us to monitor your progress and ensure you are fit for travel. VP shunt surgery in India ranges from $4,000 to $10,000, while ETV ranges from $3,500 to $8,000. Our support includes medical visa guidance, airport assistance, and a thorough medical report review before you travel. While hydrocephalus is serious, timely diagnosis leads to effective management. You can share your reports and imaging with us for a specialist's second opinion. If this guide was helpful, please like, subscribe, and share.